The injuries are severe enough to require hospitalization. 2/3 of these are in the younger population. Again, let's see here. The sports-related injuries, the most common ones are to what we call the soft tissues, mainly the muscles, tendons, and ligaments. These comprise of the sprains, the strains, contusions, which are the bony bruises, the bruises. Tendonitis, bursitis are also within that category. All these type of injuries, regardless, can take a long time to heal, unfortunately. We break them up into two categories. The acute, which is the result of a single event. These usually result in the inability to continue to play. Fractures would be in this category, but soft tissue injuries can comprise of not only the acute injury, but also the overuse or chronic injury, which is the other category. Typically the result of repetitive insult or repetitive trauma to the tissues. These can impact the ability to play and can have lingering effects. Soft tissue injuries, initially when they occur, we want to focus on RICE, which I'm sure many of you are familiar with. You start with obviously resting the body area. You want to get ice on it. We probably have all heard of the 20 minutes on, 20 minutes off, which is just a good way to start. Compression of the area to control swelling as well as elevation when possible. The overuse injuries, however, we break up into 4 stages, where the acute injuries, are basically broken up into the severity of the injury, mild, moderate, or severe. But in the overuse injuries, it ranges from the minor, meaning that it really only impairs or causes dysfunction or pain after the activity, all the way through to pain that is pretty much constant and even interferes with normal activities of living outside of this sports activity. The overuse injuries, unfortunately, are really on the rise. We see them really occurring now more in the younger age population, which is very concerning. 50% of the injuries we see in the youth are in this overuse categories, and these can have significant impact, especially with regards to the shoulder and elbow, as baseball seems to be one of those sports that is kind of a culprit for that. And what I mean by that is a lot of these kids now are sports specializing. They're getting into one sport, playing it year round with no breaks in between seasons, and they're starting to do this at younger ages. And many of these kids, particularly baseball and soccer seem to be the big two, are playing on not just one team, but multiple teams. It can be a big problem, particularly if the young player is a pitcher and he pitches for multiple teams simultaneously. This does not allow for adequate rest and puts a lot of stress on these growing bodies. These overuse injuries are very highly preventable. Most of the time they occur in the fall, when we see the kids coming back from their summer breaks and they were not keeping themselves fit, and they try to increase their training too rapidly, and they get these overuse or injuries. The biggest cause of this really is poor mechanics. And that's why poor mechanics, is what we focus on. That's why I send people to many times to physical therapy. The therapists are very good at correcting an individual's mechanics. I repeatedly get looks from people who are very active, and I say, you need to go to PT, but I do enough working on my own. And I stress the importance of physical therapy for this reason. Once they feel they have the mechanics down, then sure, they can go ahead. But poor mechanics only gets worse with time, so it must be corrected at the onset. And with the younger children, it's more concerning with these poor mechanics getting worse with time, but also the consequences of these chronic injuries, which can lead to permanent damage. Because remember, their tissues are still growing. This is an elbow, for example. On the left side is the normal growth plate on the medial side of the elbow. And then on the left side, you can see that the growth plate is a little bit wider there, demonstrated by the arrow. And that's just, from chronic stress. This was likely a thrower. And then this can lead to changes in bone shape. We've seen this in the shoulder, particularly with pitchers, and this can have long-term consequences. even well beyond the time that frame that they stop playing sports. One thing to keep in mind is to avoid not only specific sports, but avoid specific training routines. You want to train the entire individual, train the entire body, but also incorporate appropriate time for rest. The stressing that play multiple sports throughout the course of the year. This allows different muscle groups to, rest and avoids the repetitive stresses. And can be very beneficial. Again, prevention, you want to educate the young athlete to train not only specific body parts, but to be responsive to any abnormality they may feel, any discomfort that they may experience. For the coaches and parents out there, you got to keep an eye on some of these young athletes because they can hide injuries because they don't want to miss a game. So you got to be mindful when they're looking like they're not performing to their max, or if they're showing any signs of limping or any grimacing that may be tipping us off to an injury. You have to stress them it's better for them to miss one practice than it is to miss a game or even a season, as some of these injuries will continue to get worse. The American Academy of Pediatrics, due to the response of this increase in injury, has basically outlined some guidelines. Maximum of 5 days of sports participation with a minimum of 1 day off per week. I guess that should probably be 2, so then you have the full 7 days. But more importantly, prior to puberty, it's important that the child participate in multiple sports and have appropriate time off from any particular sport. It's recommended 2 to 3 months. Again, children who play multiple sports over the course of the year have been demonstrated to have fewer injuries with less severity. How about for the rest of us? Well, it's important to maintain a good exercise program, not just for overall fitness. It also prevents injury. And I broke it down into kind of categories that you need to focus on in order to prevent injury. First and foremost, it's important that you have a proper warm-up before participating in any activity. You don't want to go into it cold. That's when the injuries tend to happen right in the onset. This can be accomplished with just a few minutes of kind of getting the blood flowing, if you will. In the pre-participation period, you want to focus more on what we call dynamic stretching. Static stretching is what most of us are used to. It's probably what most of us had to deal with when we were in high school and we played sports. Static stretching is you stretch, you hold that position for 10 seconds under stretch, you relax, and then you repeat. Studies have shown this not only reduces an individual's performance, but actually may increase their risk of injury. The dynamic stretching is something more on the new side. I see this now covering football games, that the transition has been made in many of these schools, thankfully. This is more stretching with constant movement. It helps to just get the blood flow increased to the muscles, begins to activate the nervous system. This is an example of some good dynamic stretches. This was a kinesiologist I used to work with who's demonstrating several ones. And this just takes a few minutes to go through. Really will accomplish the ability of getting the muscles stretched, getting the blood flowing, and again, activating the nervous system, all of which will get the individual ready to participate, and more importantly, reduce the risk of injury. I'll just let this video go for a few minutes here. So it's just a combination. And again, watching some of these teams prep on the sidelines, I'm seeing a lot of them do this now, which is very encouraging. A few teams, however, are still doing the static stretching, and I've talked to trainers about trying to transition to this more dynamic stretching. The studies have definitely proven the validity of this activity. And I'll just let this go because this goes on for a little bit. But he begins to repeat this. This is something I can go back to and play at the end of the talk. For the sake of time, I'll keep moving. Then after the participation, it's important to adequately cool down. It's not just stop and go on and move on with your life. You gotta slow down your activities, kind of let the everything kind of settle. So it's continuing the activity at a much slower, gingerly pace, and just allow a transition period. It's during this cool down period where you can transition into the static stretching, and make sure you adequately hydrate. So the general rule, dynamic stretching before participation in any activities, and static stretching after play. Static stretching can also be done periodically throughout the day if you're not going to be participating in any higher level activities. It's just a good way to keep the body limber. More importantly, be constant with your activity level. We see a lot of injuries. These individuals are just these weekend warriors that during the week they're kind of taking it easy, and then they try to cram everything in a short period of time. That's when most of these injuries seem to occur. The recommendation is 30 minutes of moderate activity a day for the adult. This doesn't have to be done all in 30 minutes. You can break it up. Just things that you can do on your own that include moderate activities, walking the dog, working around your house, playing with your kids, using the stairs instead of the elevator, or even parking further away in the parking lot. Obviously, that's probably weather dependent. Be prepared. If you're going to start a new sport, you're a beginner. You want to make sure that you are doing proper technique, that you know how to play that sport. Take a lesson if that's available, or learn from somebody who has played that sport. It's a good way to prevent having any of these overuse injuries. And in any sport too, make sure you have the proper equipment. Shoes are kind of the big thing. You want to make sure you have a good supportive athletic shoe, particularly if it involves a lot of running and jumping activities. And more importantly, listen to your body. Unfortunately, as we age, we just can't do what we used to do. We're not as limber. We're not as flexible. It takes us longer to recover. So you might have to tone it down, so to speak. It's just unfortunate part of getting older. As for the training aspect, you want to listen to what we call the 10% rule. Basically, you want to just increase your activity gradually. 10% per week is a good guideline. So if you are a runner, for example, you want to increase your pace or distance by 10% per week. I wouldn't do both at the same time. And it's a good way to prevent these overuse injuries and just injuries in general. This will also allow adequate body recover and healing. Just to keep in mind that the average athlete, and this includes the professional athletes as well, it'll take 6 to 8 weeks for steady training to get to peak performance. So it just can't be done in a short period of time. That's when we see those overuse injuries. It also needs to be balanced, which I'm sure I alluded to earlier, that you want to, train the entire body, not just certain muscle groups. You want to incorporate a cardiovascular exercise, strength, and of course, flexibility. Flexibility will help to prevent injuries, most importantly. And a lot of times these can be combined. There's the high intensity workouts now, which are very effective, but just be very cautious. If that's something you want to start, you got to work up very slowly. And again, add new exercises very cautiously. I recommend one new exercise at a time. Don't just jump into multiple exercises at once. That's when you can get yourself into trouble, because that's when you can, lose your technique, and that's when you can have poor mechanics and lead to injury. Some general exercises that I tell everybody, especially with knee pain, or some of the ones I illustrate here. If you do go to the gym, the leg extension, which is the one I have the cross out over, that's generally you want to avoid. It just commonly causes a lot of anterior knee pain. The good substitute for that is the leg press, which is shown next to it to the left. You want to just focus on those quads. They are the key to protecting the knee. Their range of motion is, knee straight to about 90 degrees. If you stay within that range, you're less likely to overwork the joint and cause any strain of your knees. Also, what's really good for the lower extremity joints without putting too much stress on them are non-impact exercises, such as the elliptical machine and exercise bike, which I demonstrate here. I'm going to transition to the shoulder. This is just something of a late that we've been looking at as we're seeing more and more shoulder problems. Mainly in this population, we're seeing more and more individuals with this postural dysfunction. The shoulders are rounded, the head's forward, they're having more curvature in their upper spine. Whereas here on the diagram, the picture on the right, this young lady is standing proper. The shoulders are back. This is the ideal anatomic position where the shoulders are not rolled forward, where they can be in a poor position, which can lead to poor mechanics and therefore injury. This postural dysfunction, leads to, tightening of the muscle of everything up front and kind of loosening or stretching of everything in the back. And that can then lead to impacting motion of the joints as a whole. One thing with shoulder pain that we've seen of late, and this is also ties into that postural dysfunction, is something I've coined weightlifter shoulders. I'm seeing a lot of young males, and even now on the rise in females, because they're getting more into the gym, and with particularly with CrossFit, they're getting this vague anterior shoulder pain. On exam, there really are no positive findings, and diagnostic studies seem to be negative in most cases. It seems to be more of a levering effect on the shoulder, which I'll get into. It involves mainly when they are doing pushing exercises, the bench press and the shoulder press overhead is when they feel this pain. One of the problems that I see, particularly in the young males, is when they're doing bench press, they're focusing on strengthening their chest, they're ignoring the muscles in the back, and they get a weakness there and an imbalance, which can cause further discomfort. So it's important for them to stretch those muscles up front, which are the internal rotators, as well as what we call the posterior capsule. I'll get into that in a moment. Now, with regards to the weightlifting shoulder and that levering effect I mentioned, this is a diagram of an individual with dumbbells, which I recommend as opposed to the bar, just because the dumbbells put you in a better position than the bar, but locks you in. When they bring the weights down, you really don't want your elbow to fall beyond your shoulder. When the elbow begins to dip further down, you actually are causing more pressure on the anterior structures of your shoulder. That's that levering effect. And we're seeing the front of the shoulder getting stretched out, resulting in the back of the shoulder getting tight. And that itself is just causing a lot of the shoulder discomfort. Joint mobility is the key to this, stretching of the posterior capsule, and I'll show you some diagrams of that, which are right here, which are very effective that one can easily do. Physical therapists can guide with this as well. These two alone have been very effective in treating this weightlifter shoulder that we're seeing, and in many individuals that I've diagnosed with that, I do this, and lo and behold, they get better. These are additional stretches. The internal rotation is the one that seems to be lacking, particularly with the athletes that are doing a lot of pushing of weights. The external rotation, however, though, is important. And then the exercises for the rotator cuff. These are three simple exercises that can be done with, either tension bands or cables. It can be done with free weights as well. The rotator cuff sometimes is largely ignored, but is essential for shoulder function. To keep the cuff good and strong, it's going to protect the shoulder and prevent a lot of long-term shoulder pain. That's really it. I wanted to try to wrap this up, and we can get to some Q&A. And, obviously this topic is quite broad, so don't be afraid to ask kind of anything. What I can do in the meantime while we do that, I can go back to that video, excuse me for flying through this, of this dynamic stretching. So I know I went through that quickly, but are there any questions?
I just want to let everyone know, if you can see the chat on the bottom of your screen, if you have any questions, feel free to go ahead and throw them in the chat. Or if you feel comfortable, you can unmute your mic to do so. We do have a couple questions that were sent in, so I'm going to go ahead and read a couple of those off first, and then you guys can feel free. So the first question that was sent in to us was, are trainers formally teaching coaches about proper stretching and rest, and how do parents find that information?
Well, one, I'm actually seeing that, like I alluded to in the talk, that I'm seeing more of this dynamic stretching. This plyometrics is another term. The static stretching still remains very important. However, it's important to, avoid those static stretches prior to. And I'm seeing that athletic trainers are attuned to this, and many schools have already transitioned to it. If you notice, when you attend any of the sporting events for your children, that they're actually still focusing on the static stretching. That's something to bring up to the trainers. And there's plenty of data out there to show that this dynamic stretching is far more effective in getting the athlete ready for participation, and more importantly, reducing the risk of injury.
All right. The next question that we had sent to us was, is Gatorade actually better than water when it comes to staying hydrated in sports?
Well, yeah, that's a good question. There's numerous sport drinks out there. Standard water does not have the electrolytes, which we are losing through perspiration. And there are numerous rare instances where, particularly long distance runners, or in the really hot weather, plain water, people can actually dilute their electrolytes if they're just drinking water and they're not replenishing them. So the simple answer is, yeah, the sports drinks are good. Just got to be careful. They can be very loaded with sugar. During participation, that's probably fine, because it is providing a burst of energy. But be mindful of that if you're doing this to work out, but to lose some weight at the same time. You may be counterproductive with all the sugar you're ingesting.
Have you heard of those liquid IVs? I drink them all the time, but I'm sure they're pure sugar. Are those good or are those bad?
Yeah, I've looked into them briefly. Again, you got to be careful with the sugar. They do add a lot of sugar for the reason of taste. They're going to taste better if they're sweet. It's just that simple. I'm sure there are low sugar options out there. I find that one thing you can do, you can kind of make your own Gatorade, if you will. I take just water. I add lemons and limes to it, and a little of Himalayan pink salt to it. You just got to be careful how much salt you add to it. It could be a little salty, but the fruits naturally will sweeten the drink, and they're also providing the vitamins and electrolytes as well. And of course, you get the minerals from the Himalayan pink salt.
Awesome. Next question that we got. This is funny that we actually talked about this on our one podcast episode. Why do orthopedic doctors hate treadmills so much?
Um, well, yeah, as you may have noticed, I didn't mention treadmills when I was talking about talks. The reason being, there's a couple reasons. The main reason is it's still an impact exercise, meaning your foot strikes the ground. And every time your foot strikes the ground, a shock wave of force goes up through your limb. And that can be anywhere from 5 to 12 times your body weight of force. The treadmill does provide some cushion as opposed to running on the street. The faster the pace, the more impact. The other thing with treadmills, that the mistake is people put them at an incline. Yeah, you get a better workout, but you are increasing the stress on your knees and hips exponentially. So that would be the reason why, orthopods are against treadmills. The better alternative is the bike and elliptical machine, because your foot never leaves the pedal. There's no impact. It's a non-impact exercise.
All right, next question that we have in the chat is from Christopher. He says, what diagnoses are you typically prescribing for physical therapy for sports injury prevention? And have you run into issues for insurance reimbursement, especially if pain is not involved?
Right. Well, usually when it comes down to this, we're talking about body mechanics. For example, throwers, physical therapy places will have throwing programs or throwing mechanics. I've I haven't heard from patients that they haven't been reimbursed. Usually there is a diagnosis of pain or injury that coincides with it. The throwing program, for example, is usually the later stages in rehabbing a shoulder or elbow injury. So it's part of the rehabilitative process. I had a young man who was having knee pain when running, and only when running, and he was trying to get into the military, and I sent him for running mechanics, and they discovered that's exactly what the problem was. His mechanics were off. They corrected his mechanics. His knee pain went away, and that was covered by his insurance company.
All right, next question that was sent in. Can the rotating shoulder press be dangerous and cause strain on your shoulders?
Rotating shoulder press.
Know that one.
Yeah, I'm not sure if they're just talking about flies or yeah, well, the shoulder press, I'm assuming if he's talking about overhead presses and rotating at the same time, yeah, you want to move in basically one plane. It puts less stress on the joint. Typically, with the weightlifters, I try to tell them to try to avoid doing the overhead, particularly with heavy weights. It just puts a lot of undue stress on the shoulders. A lot of the shoulder exercises can be accomplished, believe it or not, below shoulder level. Lateral raises, for example, you only need to come up to shoulder level. But I do shoulder presses from time to time, but I tone down the amount of weight. It's better to do less weight and more reps, and I can combine it with other motion activities. Thrusters being an example. What that means is, I hold on to the dumbbells like I'm going to do shoulder press. I go down into an air squat, and then when I come up, I go into a press. So you get a full body workout. But that is a combined motion, but you're combining multiple body parts. The combination of motions at the shoulder at once can be too taxing to the joint. Yes.
All right, another one we got. Can older running shoes cause more damage than good?
I'm sorry. Can you repeat that?
If you're wearing older running shoes, can that actually cause more damage to your feet than good?
Well, you want to make sure you have good, adequate support, and now, especially the shoes today, have a great cushion. It's when the shoes wear, what's going to happen is you're going to have your feet either what we call supinate or pronate, and that'll then change angles not only at the feet, the ankles, the knees, and hips. So it's what we call kinetic chain. So any abnormal wear is going to potentially affect the entire lower extremity all the way up even into the low back. So it is important that that the shoes are replaced when they have wear like that. They're all different types. You got to make sure you find a comfortable shoe, has adequate arch support, and that your foot is not either rotating inward or outward, and that either supination or pronation, which could then affect your joints above. So yeah, I would try to avoid using old shoes that are worn.
All right, so those were all of the questions that I had, but I'll give everyone a minute. Once again, if you have the chat in the bottom of your screen, you can go ahead and, we just got a couple more in. Let's see. We have, what is the safest way to deadlift? I stopped deadlifting months ago because after the lift, I would always get lower back pain.
Okay, now deadlift is something that you have to be specifically trained in. I personally haven't done them because I want to make sure I'm doing them properly. You got to have the proper equipment. The reason you're having the low back pain is you're actually using your lower back and not using the hamstrings and gluteus maximus, which are the muscles that are actually the focus of that exercise. it's one of those things that you either need to be in the hands of a personal trainer or physical therapist to make sure the mechanics are done properly. And you have to start off at a low weight, get the mechanics down first and foremost, and then slowly increase your weight. That way you're not overloading your back. If you're having low back pain, that comes down to poor mechanics.
All right. Next question we got is, what is your opinion on foot orthotics versus intrinsic strengthening?
Well, I'm not a foot and ankle specialist. I do send people, however, for orthotics when I notice that on standing barefoot and the examining table, they either have a flat foot or they have a high arch, where the orthotics will help correct that and make sure it evenly disperses the stresses. And and you said intrinsic strengthening, I think, was the second part of that. Intrinsic strengthening. Well, that's extremely important. I think they can both be done in combination. Now, the orthotics is going to correct, just alignment abnormalities and provide support, but the intrinsic strengthening is key. I wouldn't say one can replace the other. Not everyone needs orthotics. Where then, sure, intrinsic strengthening is all they need, but it's orthotics are going to again correct any abnormalities of foot position, and then intrinsic strengthening will help to reinforce that.
All right. So if anybody else wants to put their question in the chat, or if you feel comfortable, you can unmute your mic and ask. I'll give another minute just in case anybody's typing. A lot of great questions today. We got favorite muscle in the body.
My favorite muscle in the body? I don't know. Serious or joking? I don't know. I'm just kidding. I don't know. Oh, geez. I don't know. The muscle that I probably talk about the most is probably the quadricep muscle group, just because it is just so important for not only the lower injuries we treat, but just maintenance for the knee. It is the key. You keep your quads strong, it prevents knee pain. After anyone's had a knee injury or really a lower extremity injury, the first thing we see is those quads just atrophy. And people then get caught in this downward spiral, and if they don't correct that weakness in those muscles, it's very detrimental and very hard to recover. So I don't know if that's my favorite muscle, but I guess it's one I talk about a lot. In the upper extremity, it's it's mainly the rotator cuff muscles, mainly because I do a lot of surgery on those, I guess.
All right. So I think that is just about all of the time that, oh wait, let me see.
There's something here.
We're getting so
Okay.
many good questions.
What modalities would you or would not recommend? Well, actually, there really aren't any that I would not recommend. The dry needling is, probably something that I think is still kind of unknown. Taping, the K tape, I think is very beneficial. Taping to provide stability to a joint, like taping an ankle. We know that after about the warm-up period is rendered ineffective, you're better to have an ankle brace, one of the athletic braces. But the K tape has been very effective. Cupping, I guess that's still kind of on the newer side. I don't see any detriment to it. It does help to increase the blood flow to the area from that the pressure vacuuming effect. And BFR, I'm not sure what that stands for. So, but A lot of the modalities are extremely important. The e-stim that the therapists use, some people actually buy their own personal ones. They're quite effective. I have, for myself and my kids, I have the foam rollers. Those things are just excellent to have. It's an easy way to, get the muscles. You can do it pre and post activity. When you have the sore muscles after activity, you just get a foam roller is excellent. Some people have invested in those massage guns. They work quite well as well. I don't really see any downside to the modalities out there.
All right, awesome. So I
Blood
think
flow
we got
restriction therapy. Okay. Yeah. Yeah. The blood flow restriction therapy. Yeah. The concept of that is causing a metabolic burn, increasing the, lactic acid in the muscle. That's more for muscle building. And that is actually one way to really effectively build muscle. I've seen, athletes, what they do is they'll put on a tourniquet above their bicep and then, work out their biceps. So what they're doing is forcing the muscle to go into what we call anaerobic respiration, builds up lactic acid that helps the burn and helps break down muscle tissue so it can be rebuilt, in a bigger, stronger fashion. It's just an exercise technique. However, when we're in the healing process, we want to actually overload the tissues with oxygen. But I think it's a very effective technique for training.
I think we had one more thrown in the chat. While the knee recovers, can you continue to ice until it's fully healed from a walking injury?
Yeah, ice is, of course, the first line of defense with any injury, because immediately what's going to happen is what we call inflammation. That's the swelling. You want to get that under control because that can be quite extensive, cause more pain, and actually be detrimental to the tissues. Icing is just one of those things that, yeah, you're going to continue pretty much till full recovery. At some point, yeah, heating the joint or muscle is what you're going to transition to. As a general rule, you want to heat for about the first 72 hours after an injury. If it's more of a muscle type injury, then you can transition to heat after that time frame. But the joint, you really want to focus more on the icing, particularly if there is noticeable swelling. Obviously, in the shoulder, you're really not going to necessarily see swelling, but in the knee and the ankle, you will. And ice is very important. And once you get into the rehab component, icing afterwards is very important. And if you've been to physical therapy, you'll notice the therapist will apply heat, get the joint warmed up, get the blood flowing, go through the therapy session, and then apply ice to cool it down to reduce any potential irritation or inflammation that may have been stirred up in the rehab process.
All right, great. So I think now is a perfect time to wrap this up. Thank you so much, Dr. Junkin, for doing this.
Thank you.
It was super informative. I even learned a lot. In case anybody missed my little spiel in the beginning, I do just want to remind you all that we do these educational seminars every other month. So you can go to www.cvortho.com under upcoming events and see the latest things. Also, be sure to check out the Seaview Ortho podcast so you can check out Dr. Junkin and the upcoming episode that'll be coming up in around April. Spotify, Amazon, Apple Music, wherever you listen to your podcasts. And if you guys want to sign up for our newsletter on cvortho.com, again, you can just stay up to date with all things Seaview. So thank you guys so much. This was a recorded presentation, so if you missed it, if you found it, or if somebody missed it, if you found it to be really great and you want to share it with friends and family, I'm going to be sending the link to it in your emails tomorrow, so that way you can share with other people. And yeah, again, thank you, Dr. Junkin. Thank you, everyone, for hopping on, and have a good night.
Thank you. Have a good night, everyone.